Good morning.
Good morning.
I'd like to start our lecture with telling you what children aren't. They are not perfect little beings just waiting to be screwed up by the parents. This is sort of the popular misconception of modern society, right? Kids are, by nature, out of balance. It's natural because they are afflicted by, I think what modern physiology, they call something like non-parallel development, meaning that certain things develop too fast and other things develop too slow, and therefore they're out of whack until they grow into a balanced perspective. And Chinese medicine has recognized that for a long time. So we can really help to reduce the extremes of this disparity in development and really make childhood much more comfortable for everybody. But before we go into those specifics, I was speaking here. When was that? When was I here last?
It was March 1st and 2nd last year.
Last year, March 1st, 2nd, and I said to Andrew, I'd really like to lecture on pediatrics. It's really my specialty area. And he says, oh, I don't know that people are that interested in treating kids, you know. Well, I've been sort of on a crusade for a long time to get people in Chinese medicine really interested in treating kids for a variety of reasons. First off, what modern medicine tends to do to children is often overly aggressive, and we can really do so much to prevent that. Secondly, there are a lot of things for which modern treatments just aren't useful. For example, in all of the I say that aren't useful, like all of the behavioral disorders that are so common today. Modern medicine's approach of using medications with kids. You know, I've practiced for so many years in San Diego. There were many classrooms in San Diego where 60% of the kids were medicated. 60% of the kids in one classroom medicated. Something's not correct there. We really can do a lot for that situation. But beyond, and something my old mentor, I had an old Korean mentor, a sixth-generation practitioner, he would always laugh when he would come to the States and treat people because he'd say, oh, you people in America have no grandmothers. Because people would come and ask him things about parenting and child care and weaning kids and these and that kind of thing. He'd say, no one comes to me and asks me that in Korea. They go to their grandmother and ask them that. What should I feed my kid? When should I wean them? But people here don't have this. I mean, we can only look at the issues right now. I've seen several articles in the newspaper around breastfeeding, and all these lactation coaches and things are now coming online because people don't know how to breastfeed. In Korea, people just ask their grandmother what to do. You know that. So we don't have grandmothers. So part of what we're doing in Chinese medicine, we're becoming people's grandmothers again. You know, trying to maintain some of this sort of folk wisdom and how to manage kids, and everything isn't a medical emergency. But that's the perspective from working with the kids. There also is the perspective from your own practice. Kids are really well networked. Therefore, when you treat one child, you will get many of them, so it is a big practice builder. So from your own personal side, it's really good to treat kids. You'll end up treating a lot, and they're all in sports teams and play groups, and you get them all, right? So it's very, and plus, unlike most of your adult patients, kids change quickly. So it's such a joy to treat them. You see the results right away, and it's you know, so that makes it, and then they're fun. They come in, you play with them, you know, it's like your friends coming to visit. You know, they don't come in, I'm depressed. They never say that, you know, right? So, you know, so there's a lot of reasons to treat kids. And so I say, I've been on sort of a crusade. So I sort of laughed when Andrew said, oh, I don't think people are all that interested in treating kids anyway. Well, I tell you, I see by you all coming, you are interested. And if you haven't worked with kids very much, you're really going to like it in your practice. And you can really do so much good work in this field. So that's sort of just the little intro to pediatrics. So we're going to try to balance out these inherently unbalanced little beings. And remember, they're not perfect beings, but they're not small adults either. So if you try to treat them based on strictly adult principles of treatment, you don't get the results you'd expect a lot of times. I have a story I always love to tell about this because many years ago now, I had a good friend who was we actually started practicing together. We opened an office together after we got out of training back in 1979. And then he went to China and studied for many years, and he became very fluent in Chinese. You know, the way to become most fluent in a language is you have a significant other of that culture, right? So he married a Chinese woman, and his Chinese became perfect, and he started doing a lot of translation. So I always looked to him as kind of an authority on many subjects because of it. But I was all the while, meanwhile, treating kids. So one day he came to me and said, you know, I'm having really struggling with this kid with recurrent ear infections, and I've tried all the normal stuff I do, and it's just not responding. The ear infections just keep recurring. And I asked him what he'd use, and he told me which herb formula he was prescribing. And I said, oh, why didn't you start with Shao Chai Hutang, minor bupleurum formula? And he's like, because that doesn't match the pattern. I said, no, you have to try Shao Chai Hutang. Oh, no, that's wrong. Okay. Well, I saw him again then some months later, and almost irritated, he says to me, I did try that, and it worked. Well, even though he was so knowledgeable, he wasn't thinking with a pediatric perspective when he was diagnosing the child. So he didn't see that, in fact, the correct formula was Shao Chai Hutang, even though the child didn't have the adult characteristics that you'd expect for that formula. So this was, you can't be rigid about applying your adult model. So we're going to begin this morning with the basic characteristics of what a child is. And I always say that if you remember this part, you can do everything in pediatrics. You don't need all this very detailed specifics. It's these basic principles of what a child is and balancing those that's going to get you the main results in your pediatric cases. I sometimes start this lecture one way and sometimes start the other. Sometimes I start with just talking about the development of the child, but I think today we'll just jump into these special factors of what a child is. So this is on the second page of your handout packet, page 2. Now I put on there some representative herb formulas under each issue, and we'll talk about those herb formulas. We'll also talk about points and massage techniques and so forth. We will, in the weekend, go into such issues as how to get kids to take herbs and what the dosage is and how to do needling on kids. And we're going to learn the basic pediatric tuina as well as the Japanese shonishin this weekend. I think those of you who haven't studied with me before, my approach is always to try to empower people to do things. And so, for example, the Japanese shonishin is something you're going to learn in about half an hour. And yet, I know there are people who teach seminars in Bali for weeks on shonishin. Now, it's a good excuse to be in Bali, but I don't know what they could possibly talk about shonishin for more than half an hour. I mean, there's nothing to it. You can all do it, and you don't need to go buy fancy tools to do it. You can do it. In fact, it's better if you don't have fancy tools to do shonishin. I actually have a set of shonishin tools just because I'm teaching lectures on it, but I would never use them clinically. First off, the kids steal them from you, and then you have to buy them again, and they're expensive. Secondly, they kind of scare the kids because they don't know what they are. It's much better to do the shonishin with just average stuff, whether it's forks and spoons or little toys or whatever. After all it is a massage tool, right? And so we will learn to do shonishin, and it will be very effective for you. In fact, is a very good preventative maintenance thing. Takes only about 10 minutes clinically to apply. You can do it on a once-a-month basis during the flu seasons or whatever, and kids get a huge benefit. Even the Japanese government did a study on this, and they started to pay for kids to get shonishin because they found they had fewer upper respiratory infections and missed school less often. So these are really useful tools that you can learn very fast. And so we're going to go through all those things. So don't worry in this first little introduction here as I go through, oh, use this herb formula or use these points. We will come back to how to actually apply that. But first, let's learn what the aspects of the child that we have to consider in treatment, what those aspects are. First off, kids are vulnerable to external evils. The reason they're vulnerable to external evils is because, well, the reason, in fact, that they're vulnerable to many of these aspects of them is that children by nature have a weak qi-ji. You know this Chinese term qi-ji, qi machine? You know, some people like to say chi mechanism because machine. The chi mechanism, the chi machine of a child is undeveloped. In fact, it's so undeveloped, they don't even have all their meridians freely flowing yet. We know that the meridians don't achieve full free flow until puberty. This is when the Chongmai and the Renmai finally penetrate through, and then you're finally fertile. Of course, boys can actually father children at a younger age, but that's very taxing to their kidney. This is why you see many traditional herb formulas to be given to very young boys if they have to father a child. For example, this was the emperors. When an emperor it was very dangerous to be an emperor and not to have a male heir, because then people would like to knock off the emperor because that would create this whole issue of succession. And so the emperors, you know, sometimes a young male would ascend to the throne and would have to try to father a child. This was very depleting to the kidney. Why? Because they were actually trying to put forth that jing before their meridians were free-flowing. So children have a very weak qi mechanism. They can't raise wei qi to the surface very well. And this qi, let's think about this for just a second. I'm going to take this slide off and just write on here a few things. When we talk about the so-called the qi ji, one important part of that is the wei qi balancing with the yin qi on the interior. So the yin and wei balancing is very important. Kids can't do this very well. So we have to be very concerned with getting the wei qi up to the surface, protecting their interior. The yin qi on the interior doesn't circulate very well, so we have to really invigorate and make the qi circulate. For example, children should never have cold spots on their body. If you touch a child anywhere and it feels cold, by warming it up, you will be doing therapy for them. Now, of course, we can be more precise about this and say kids who have cold hands and feet typically have liver qi stagnation. Kids who have cold butts typically have kidney deficiency. Kids who have cold abdomens typically have spleen deficiency. But you don't have to think about that. You don't have to think about what does it mean. You have to think, when I touch a child and I find a cold spot, I'm going to just warm it up. And already, you will redistribute the yin qi, and the child will be better off for it. And so this is a very simple technique, doesn't require any diagnosis really except touching them, and then whatever method you want to use to warm them up. You could do moxa, you could do frictioning massage. I have a special tool for this. This is excellent. Also, it is not scary to children, because even young kids are familiar with this at home. They think you're crazy because now you're blowing this on their butt or their back or whatever, but it's really therapeutic. And, you know, unlike taking out the moxa stick and kind of scaring them with that, this works really well. So this is something we'll get into as we progress here, of how to, it's really the failing I see in a lot of the written materials available to us on Chinese medicine pediatrics. They always jump into, here's the disorder, and then here's the syndrome differentiation. But they forgot to talk about, well, how do I approach the child, and how do I work with the parents, and all of that stuff that really makes your treatment possible, even, right? So this is something we're gonna put some attention to this weekend. But for the technical details, we can say the yin qi tends to clump up and get stagnant in the body in kids, and if we can always, this is why not just warming up cold spots, but just touching them a lot all over their body is therapy. We know this from kids who have developmental disorders. Simply increasing the amount of physical stimulation doesn't, again, have to be some fancy Tuina technique, but just touching them all over circulates the qi that has a tendency to become stagnant, and they benefit. Their development is enhanced by that. You know, this is when we're talking about practice, this is an area to really work in, and you'll get so much input for developmentally challenged kids, especially kids who have been drug exposed in utero and stuff. I had a experience many years ago back in San Diego. I was treating a social worker for a problem of her own, and we started talking about kids, and she began to refer to me then a lot of drug-exposed kids, whose mothers had used various drugs during pregnancy, and the kids that the reaction to the treatment was so profound. It really enhanced their development, and really I think it didn't have anything to do with any advanced knowledge of Chinese medicine. It was just that increased stimulus. It really promotes that development. So this is the first part of our qi dish. We have to balance the yin and the wei. Now, for those of you herbalists in the class, I would ask, what is the basic herb formula in Chinese medicine that balances the yin and the wei? Guizhi Tang, of course. So Guizhi Tang is a